All right, well, good morning. My name is Chris Arena, Communications Analyst at Health Workforce Development. We're excited that you have joined us today for the Behavioral Health Scholarship Program webinar. Before we begin, I would like to discuss a few housekeeping items. The webinar will be recorded and posted on our website in approximately 7 to 10 business days. The chat option will be open during our Q&A session, which is at the end of this webinar. And at that time, feel free to place questions in the chat. This slide deck is posted on our website, and a link will be found in the chat box. And today, we wanted to quickly take a poll to see who our audience is. Results are anonymous. Please fill that out as you come in. And with that, I am thrilled to introduce our first presenter, Karen Rizel, Deputy Director in Health Workforce Development.
Great, thank you, Chris. And thank you everyone for joining us here today. We're really excited to share with you information about a new program that we have. This slide in front of you just shows the things that we're going to cover. We want to make sure that we provide information about the program, about what it covers, who is eligible, how we score the program, and provide opportunity for questions and answers during this webinar. So on the next slide, I just wanted to provide an overview of HCI and the program. So if you could go ahead and move to the next slide, thank you. Next slide, please. Thank you. So for those of you that aren't familiar with us, Department of Healthcare Access and Information, or HCI, our mission is really about what is stated here on this slide. It's about expanding equitable access to quality, affordable healthcare for all Californians. And so our health workforce programs attempt to do that, to deliver access to care, to increase and diversify the health workforce. On the next slide, wanted to share a little bit about HCI. So some of you may have known it as OSHPD, but in 2021, we changed our name to Department of Healthcare Access and Information. On the next slide, just wanted to talk about the work that we do in our health workforce programs. So our health workforce programs have three key objectives, and we want to support and build a workforce that serves medically underserved areas, to be able to serve those areas of California that may not have the providers that it needs. To build a workforce that represents the California it serves. California is a diverse state, and we want to build a workforce that represents and serves the diversity that we have. We also want to be able to serve those in our communities, our Medi-Cal population. So we want to ensure that our programs reach throughout the state and serve as many Californians as possible. So to do this work, we have three main areas of programs. We have programs that provide financial support for organizations to expand the number of professionals trained. We also have programs that provide financial support for individuals to pursue health careers through scholarship and loan repayment, and that's exactly what our Behavioral Health Scholarship is aimed to do. And then we also have programs to build the pipeline of our health workforce, is that we need to be able to build the workforce now, and we need to build and support the workforce of tomorrow. So for our Behavioral Health Scholarship Program, if you can go back a slide, please. That is a new program for us, so we're excited to be able to offer an opportunity for behavioral health students to be able to apply for a scholarship. As stated here, the purpose is to increase the supply of the behavioral health workforce in California. We are fortunate to have a significant amount of funding to be able to fund individual scholarships of up to $25,000. And this work is funded by our several-year Children and Youth Behavioral Health Initiative, which really supports building the behavioral health workforce to serve children and youth 0 to 25 years. Also wanted to point out this program on the next slide is that we have funds as well to be able to support professionals intending to provide services in reproductive health settings. And so when you see the application, you will see there's an opportunity to indicate whether you plan to provide reproductive services. And so we just wanted to point that out, that those funds are available, but that it is for specifically for individuals who are interested in serving in those areas in a behavioral health capacity. But also to be able to support those professionals, the behavioral health professionals serving in behavioral health settings throughout California as well. So I'm going to move to the next slide, and then in that I would like to introduce, if you can move to the next slide, is our next presenter, Ann Powell, who is a health program specialist who will talk to you with more information about the program. Thank you.
Thank you, Karen. As Karen said, I'm Ann Powell, a program specialist in our policy section, and I'm going to outline a few things about the program. Next slide. So first of all, as you know from the application or the grant guide, you can see that we are supporting individuals seeking behavioral health careers in a broad range of disciplines. On this first page is a list of everything from introductory kinds of careers, like first stage of education, like a community health worker, on into licensed clinical positions like psychologists and social workers. Next slide. And this continues to show the professions that are eligible for this grant program. And thank you. So award levels could be full, partial, or no funding based on the applicant's scoring criteria, how applicants score based on our criteria, which is outlined in the grant guide. We seek to achieve geographic distribution for our programs across California. In addition, applicants will be awarded only the total cost of attendance for 1 year of their education. And then within 6 months of graduation, awardees would need to begin their 1-year service obligation, providing direct client or patient care in a qualified work site. Next slide. And with that, I'll turn it over to Christina Gonzalez in our grants management section.
Thank you, Ann. Hello, I'm Christina Gonzalez, and I'm the program officer for the Behavioral Health Scholarship Program. I'm going to highlight some of the key areas of the application process for you. If we could move to the next slide, please. So as you can see, our application is divided into 9 sections. As you're completing the application, I want to let you know that as you complete each page and you move on to the next page, it is automatically saved as you move through the application. The 2 sections that I would like to point out specifically are the number 7, the employment history. And I would like to advise you to get the information together regarding your past employment in order to provide the relevant dates, places, and names during this section of the application. And also the required documents, which is section 8. There are 3 required documents that you will have to upload along with your application in order to be eligible and to be considered for these awards. The first is a cost of attendance document, which you must obtain from your school. And the second is a scholarship program verification form. This is completed by your program director or the appropriate designee at your educational institution. And the third will be a conflict of interest letter that will indicate that you don't have a conflict of interest with the state of California employer or with specifically with the Department of Healthcare Access and Information. So once you have that information together, generally speaking, you'll be downloading the information, the documents in the application. you can go ahead and complete your application. If we go to the next slide, please. This slide deals with the post-award and payment provisions. It's mainly the main points of this slide are that when you are applying for this program, you need to make sure that the address information that you're providing is your residential address on file, and that it matches the address that the IRS has on file for you. Because if there is a difference between the two, that will delay your payment. I do also want to point out that if you enter into the grant agreement with us, you need to ensure that you can meet the service obligation. Because if you do not, you will have to pay not only the money back, but also penalties. So, you need to ensure that you will be able to complete the service obligation if you're applying for this program and accepting the award. That is all I have for you now. I am going to pass it over, go to the next slide, please, to Kevin McEvely, the Research Data Specialist, to go over the evaluation and scoring procedures. Thank you.
Thanks, Christina. Yeah, I'm Kevin with the Research and Evaluation Office in Health Workforce Development. I'll be talking about evaluation and application scoring procedures. Next slide, please. At the time of application closing, we'll be evaluating each application for the presence or absence of required information to conform with the application submission requirements. We may reject applications that contain false or misleading information. And we will use evaluation criteria as it's described in the grant guide. I just want to point out here that at the top of the chat, there's a link to our behavioral health programs pages on the HCI website, and you can find any updates as well as our scoring guide there. So please keep an eye out for that website in case there are any updates about this program. Next slide, please. If you have applied to any scholarship programs at HCI before, you might be familiar with these scoring criteria. The first is languages spoken. Full points for an applicant who speaks one or more of the listed languages fluently or well enough to provide direct care services to clients. That list is the list of Medi-Cal threshold languages. Also, our second criteria, having volunteered or worked in a medically underserved area or with medically underserved populations in the United States or overseas. Third evaluation criteria is the graduation date. Full points if the graduation date is within calendar year 2024, and partial points if it's after that. The next point is economically disadvantaged, as defined by the Scholarship for Disadvantaged Students program, identified as having a disadvantaged background based on environmental and/or economic factors, or received a federal exception financial needs scholarship. And the last item that will be scored is GPA. Full points for students with a GPA above 3.0, and partial points for a student with a GPA between 2.0 and 3.0. And with that, I'll kick it back to Chris.
All right, thank you, Kevin, and to all of our presenters. This team has worked really hard to put this program together, and we're really excited to offer it to you. Right now, we're going to transition to our question and answer session. We're taking questions through the chat feature only today, as opposed to raising hands and enabling audio. This will make it easier for us to answer as many questions as possible in an orderly fashion. The chat option should now be open. We'll be opening that up right now. And what's going to happen, I'm going to facilitate the Q&A session, and our presenters will answer the questions based on their area of expertise. And we will do our best to answer all of your questions in the order that they are received. And so let's go ahead and open the chat.
Having a little technical difficulty. There's a delay with the chat being turned on. It's actually not responding. So I'll need to.
Okay. We do apologize for some of the technical difficulties we're having. Microsoft just pushed an update to us yesterday, and we're still working through some of the issues. All right, Alma, if meeting chat's not gonna open up, maybe we do need to go to live questions and have people raise their hands.
Yes, I'm still wondering how they would submit their questions because they're not able to turn on their mics as well.
Well, let's try this. I'm gonna see. I see Emily. Let's see if Emily, I can turn your mic on. Emily, are you there with us?
Hi, yeah, can you hear me?
I can.
Oh, excellent. I'm sorry, I missed the first few minutes of this, but I was just wondering, what is a qualified work site?
Right. Ann, you want to go ahead and answer that?
I'm gonna, basically, our goal is to have people working in community organizations or county organizations that serve underserved communities, like clinics and drug programs, that sort of thing. So it's very broad.
Excellent, thank you.
And I can just, I believe our
Yes.
grant guide has a list of the qualified types of work facilities and sites
Wonderful, thank
and
you.
areas. Mhm.
All right. Oh, looks
Okay,
like
the chat's working.
chat is working. Okay. We have a whole bunch of hands up too. So let's do this. If you have your hand up, go ahead and put your question in the chat and we'll go to that. It makes it a lot easier for us to be able to get to everything when we have so many participants in the webinar here. So let's see here. Question number 1, Veronica, do we have to be currently enrolled in a program?
You have to be enrolled by September to qualify for this program.
All right, thank you. Tiffany, I read somewhere that grant funds will be awarded to individuals who work for nonprofits or work with patients in underserved areas. In ABA, the entire state of California is underserved as there is a large shortage of ABA staff. In that case, for ABA therapists that work for for-profit agencies, would they qualify to receive funds? And does an agency employer have to apply to be an approved site?
I don't know the answer to that question. We will have to get a response to you, but generally, as Karen said, the qualifying agencies are listed in the grant guide, and our intention is that people work in agencies that serve underserved populations.
Right, thank you. And we will find out the answer. And is there a way that we can post that to answer that question?
We'll probably have to come up with a queue and a fact sheet that we'll post.
Okay, one of the things we can do, Tiffany, if you want to email us at there'll be an email at the end of the webinar. You can email us directly and we can reply to that as well. Next question. What if I'm working as a mental health worker now? Do my time start now?
No, it starts after you complete your education.
And this program is eligible for those of you that are actually starting an educational program. So we have loan repayment programs if you wish to have help with loan repayment, but this is for students who are pursuing some sort of training program.
All right. And we answered the question of if you're not enrolled, you have until you said September.
Yes.
All right. Is there a citizenship requirement?
Karen, do you know?
I do not believe that there is. We can check into that.
Okay. Can you please repeat the required documents?
Christina?
Yep, sure. So the required documents are the cost of attendance, which basically the school telling us how much the attendance will cost so we can adjust your award to that amount. The scholarship program verification form, which just confirms that you are enrolled in the program, in your educational program, which you get filled out by your program director or a designee, and a conflict of interest letter, which you fill out, you create yourself that just says that you don't have a conflict of interest as far as getting a scholarship from us, from the state of California, from HCI, that you don't work for the state or have previous connections with the state that would disqualify you.
All right, thank you, Christina.
Hey,
Carolyn?
If I could add to that real quick,
Yeah.
Hi, my name is Clinton Ramstead. I'm the program manager here. As you're going through and filling out your application, remember you can save between pages. So when you get to the part where you have the uploads, you'll have a chance to look at that and review it. So if you don't have it readily available, you know, when you start your application, you're welcome to go into the application, get to that point, and then have a chance to look at it at that. So I mean, it's not the end of the world if you don't have it put together at that point. Okay, just remember you can save between pages as you're filling it out. That's all I wanted to add.
Excellent. Thank you, Clinton. All right, Carolyn asks, I will be representing my social work program. In terms of form, can I sign electronically? Also, in the cost of attendance, do I complete generic form for the school, or do I have the students do individual forms and I would sign?
This program is for individuals pursuing an education. So you can educate your student body about the availability of this program, and they can apply. The verification goes back to the institution, and the student will follow the instructions in the application.
All right. Is this grant for students only or also for graduates?
It's for anyone who is pursuing, actively enrolled or will be enrolled by September in an educational program. And it's for all levels of education, from a certificate to become a peer personnel specialist, all the way to a doctoral degree in clinical field like psychology.
Right. Rebecca asks, will this scholarship be opened next year? I'm applying for a 2024 start date now.
It will depend on how much funding we have after this first cycle, as to if we'll have a second cycle. It's been very popular, so we'll see. Thank you.
Lindsay asks, if you haven't started your program, is GPA counting from previous academic experience?
Correct. That's right. You would use the most recent available GPA.
Lauren Keeney asks, would a public school be considered a qualified work site?
Yes, it could be, yes. As long as you're providing direct services.
Thank you, Anne. Enrique asks, I was having trouble with validating my place of employment. It appears that there was a glitch. Can you verify this?
Christina, can you jump on, or Clinton?
You validating? Clinton, do you?
I'm sorry, I didn't hear the question.
I was having trouble validating my place of employment. It appears that there was a glitch.
Okay, glitch in the system, then okay.
Yeah,
Can
send us an email.
Yeah, if you can, please send it, like, prepare a screenshot for us and send it to us. You can send it to our BH program mailbox. We'll take a look and see what's going on, and if there's a technical issue, maybe we have to get it resolved. I don't know, but if you can send us a screenshot of what's going on, we'd like to see that, because in all of our testing, we hadn't run into a problem on that area yet.
Okay. All right. Thank you, Enrique. And I see your update there. Send us the email and we'll work with you to get that fixed. Karen asks, I am a LCSW currently pursuing my doctorate in social work. Am I eligible for this program?
Is your doctoral in social work a clinical program where you'll be providing direct services based on achieving that degree? I'm not familiar with any PhD in social work that provides direct care. So that's the threat. That's what matters. If you were pursuing a PhD in clinical psychology, that would be eligible.
Right. Tricia asks, how do we access a conflict of interest letter?
Clinton or Christina?
I'm pretty sure, let me see.
Well, it's one of the state forms that we have.
It's downloadable in the application, isn't it? Once you get to that page, you can download it.
I don't think it's in our application though. I think it's one of the state forms. Anyway, if you need one of those again, send us an email and we'll find one for you and get it for you, because I don't think we built it into our application.
All right.
It's a rare circumstance, but we'll be happy to help you. Okay, just please send us an email.
All right, thank you. All right, here, next question. I graduate June 2024. Is that fine for the program?
I want to hop in. Another person asked a question and caught a typo in the slides, so thank you very much. For the graduation date score, it's 20 points for graduation date is before December 31st, 2024, and 0 points if the graduation date is later than December 31st, 2024. So what you'll see in the grant guide is correct. It's just the slides will be updated before they go on the website.
Thank you.
Right. And then Lisa asks, if I'm graduating the bachelor's program 2024, but intend to immediately get my master's, should I put the date after my master's?
Yes. Are you, and what, Matt, it's important that you're enrolled by September for your master's program.
Okay. Can I participate in the 2020 program as well as be a recipient?
Can you repeat that question?
Marcella asks, can I participate in the 2020 program as well as be a participant?
There is no 2020 program. I'm not sure what you're asking, but we do limit funding from one program at a time to an awardee. So you can apply for multiple programs, but you will only be funded for by one of them.
Okay. Marcella, if you can provide any clarification on what the 2020 program is, that might help us on that. But yeah, if it's an HCI program, though, that it's one at a time. All right, thank you. And Claudia, if you received a federal Pell Grant throughout undergrad, does that qualify you as being from an economically disadvantaged background?
Kevin, what is the definition described in the scoring?
As described in the scoring, it is as defined by the Scholarship for Disadvantaged Students program, identified as having a disadvantaged background based on environmental and/or economic factors, or received a federal exception financial needs scholarship.
All right. Yvette asks, can you apply for this grant and other California grants like the Allied Healthcare and Scholarship State Loan Repayment? I believe we just answered that question, correct? You can apply to multiple, but you only get funded for one. Does this scholarship pertain to individuals that are in undergrad or graduate programs?
It's for individuals at all levels, from certificate programs all the way through a clinical psychology.
Rebecca asks, do we have to start our work at a qualified work site within 1 year of receiving the grant or 1 year of graduation?
It's 6 months of graduation, after graduation.
There's a question about being able to get a copy of the slides. We are going to have the slides posted on our website, and there's a link posted at the top of the chat, and we will post that link again at the bottom of the chat at the end so that you can find that on our webpage. It will be available for you to download and review. What are considered qualified work sites? Are hospitals such as Kaiser or Cleveland Clinic qualified? Megan asks.
We would refer you to the grant guide, but again, our goal is serving underserved populations.
Joanne asks, I was curious if an individual who might be awarded funding from the recent HCI Behavioral Health Workforce Grant can also apply for this opportunity. You've answered that question. If you were awarded funding, then that's going to be the program that you have.
Unless it's a prior award that's expired and you've met your service obligation already on that one, or you could apply again.
Perfect. Thank you, Anne. Anna, is this program expected to be offered in 2024 as well? Let's see. I believe we've answered that. What is included? What is included in the cost of attendance calculation? Does it include room and board?
It does. It also includes dependent care.
Are there requirements regarding the institution you attend? Does it have to be a California State University?
It can be any institution in California. Well, any institution, you need to be a California resident.
Steve asks, what's the difference between Behavioral Health Scholarship Program and the Allied Healthcare Scholarship Program?
Allied health is very broad, primarily for a range of health focused professions. Behavioral health is focused on professions in the behavioral health sector, and that includes mental health and substance use disorder programming.
Philip asks, how about employees who already work for a full-time county contracted nonprofit while in school? Will that count as time served working in public sector?
Once you have completed your education, the clock would begin upon graduation in that setting, or a future setting if you relocate.
Roger asks, does your employment history have to have jobs solely related to mental health?
I don't believe so. We encourage you to submit your history for review.
Do you have to be enrolled in school to qualify for this scholarship? I am enrolled in CCAPP for my CDAC. However, my dreams are bigger. What school would I have to be enrolled in?
The school would be associated with one of the degrees leading to the eligible professions, and you would need to be enrolled by September.
Will there be a loan forgiveness component to this program? I graduated in 2016 and I'm looking for loan forgiveness but meet other criteria.
It does not.
When I applied, I had made a mistake on my application due to the problems with Safari. Wanted to know, what do I do? It has already been submitted. So do I reapply? Asked Sandra Avon.
Could you send an email to the BH programs at hci.ca.gov mailbox, and we'll attend to your situation.
All right, Sandra, thank you. Do you know whether Kaiser Foundation, i.e. funded by their nonprofit, mental health locations qualify as an eligible site?
It's possible. Go ahead and apply. And are you talking, well, let me back up. If you're talking about where you're working after graduation, again, refer to the grant guide, and to keep in mind that it's services provided to underserved communities.
Erica asks, I'm a Chapter 31 veteran student currently in a psychology program. Do I qualify for this program?
I'm sorry, repeat the question.
I am a Chapter 31 veteran student currently in a psychology program. Do I qualify for this program?
Yes, you would.
Right. Jem asks, how do I know if I'm in an underserved area?
It's not if you're in an underserved area. It's in terms of scoring, we're looking at your your qualifications in terms of I'll let Kevin explain it. I'm not doing a very good job. Kevin.
I think they are referring to the question, have you volunteered or worked in a medically underserved area or with a medically underserved population in the United States or overseas? So that is a yes or no question. And for compliance with the direction of that question, I might turn that over to the grants team if they want to speak to that. But that how it is described in the grant guide and in the slide is how the question is asked in the application.
Clinton or Christina, can you say something about how you evaluate that response?
All right. Christine?
I think, is it based on the federal designation, the
HPSA?
HPSA? Is that what we base the underserved area on, Clinton?
For this question, I think it's self-determined because it would be in the United
Okay.
States or overseas.
Right, right. Good point. So it's really your personal evaluation of who you worked with that matters in the past.
Okay. Dominique asks, what if your program doesn't start till January, and when would the next application date be? I believe we've answered that question. Also, I graduated with a BSW. Do we need prior work background? My only background so far has been my internship.
That's adequate. Totally fine. Yes. I assume you are also enrolled in school for the fall.
They're saying their program doesn't start till January, so that's, I think, going to be the challenge there.
Yeah, so they would need to wait till the next cycle to apply.
I'm currently in my bachelor's program for social work and anticipate going directly into my master's degree post-graduation. Will this pose any issues for my application?
Just you need to verify your enrollment as part of the application.
Okay. Dipti is asking the length of time applicants are required to work at a qualified work site.
It's 1 year for this program, 32 hours a week.
Lauren asks, what are the penalties if we accept a scholarship and then are unable to find a qualified worksite placement?
Clinton, could you address that?
I can address it.
Oh, sorry.
No worries. You will have 6 months after your graduation to find a qualified work site. If you contact us, we may be able, I mean, we try to work with you, but ultimately, if you're unable to fill your service obligation, you would have to pay back the money that we paid you, and there's an additional penalty. I believe it's $1,500 a month for each month that you did not complete of your service obligation. It is in the grant guide under the breach protocols.
Thank you.
Thank you, Christina. And I'll ask, do we get paid for the obligation work after completing the program?
Repeat the question.
Do we get paid for the obligation work after completing the program?
That's between you and your agency. as to whether or not it's employment, you're employed or doing it voluntarily. We anticipate, though, that you would be employed.
Are we allowed to apply for the Behavioral Health Scholarship Program if we applied and received funding from the Allied Health Scholarship Program last year?
Are you, yeah, the question will be if you're continued to be enrolled, and if that funding, when you, so that, could you email us about that? Because it's a complicated answer. I don't want to, speculate with your situation.
All right, Dara, go ahead and email us and we'll respond to that. Jonathan asks, I'm having a difficult time finding specific information about the scoring criteria, which is somewhat vague. Specifically, what are the listed languages? What exactly is a medically underserved area? And how do I find out if I qualify as disadvantaged for this scholarship? Finally, what is my GPA based on if I'm an incoming graduated student for fall 2023?
Your GPA would be for the last educational time that you had. And I'll ask Kevin to talk about the specifics of the scoring criteria.
Thanks, Anne. So first I'll address the question about languages. I'll read the languages now, but also if you want to look it up in the future, it's published online as Medi-Cal threshold languages. There's 18 currently. They're Arabic, Armenian, Cambodian, Chinese, Farsi, Hindi, Hmong, Japanese, Korean, Laotian, Mien, Punjabi, Russian, Spanish, Tagalog, Thai, Ukrainian, and Vietnamese. So that's the list of Medi-Cal threshold languages for that scored item. For underserved areas, that it's for the purpose of this application, it is in the US or abroad, self-verified. And I believe Anne addressed the third part of that question about GPA. So yeah, if I missed anything, please type it in the chat, but hopefully that helps.
Let's do that one. That one. All right, Patricia asks, there's a question on lived experience. Are you able to elaborate on the type of lived experience asked on the form?
Lived experience in this context means that you or someone in your family has experienced a mental health and or substance use disorder condition, and that's how we define lived experience.
Great. Thank you. And Roger asks, I have an AA in behavioral psychology. Can I pick another major related to mental health and pursue that?
You can, as long as you're enrolled in that program by September.
All right. Question asks, was this webinar recorded? This webinar is being recorded, and we will have a link posted on our website within 7 to 10 days. And then we will send emails out to all of the people who have registered for the webinar, letting you guys know that it has been posted on the website. So you will see an email letting you know that everything has been posted. All right, next question. Am I disqualified if I currently work part-time for UCLA?
No, where you work now doesn't matter. It's that you are pursuing your education and that are enrolled by September.
Patricia asked, I'm in my senior year this August 2023 and have to start my internship at school districts. Will that conflict with this process if I'm accepted?
I think since your internship is part of your education, that period would be covered. So when you complete your internships towards your education, that's and you have graduated, that's when within 6 months you'd start your service obligation.
Another question on conflict of interest letter. Anyone who has potentially needs a conflict of interest, go ahead and email us, and the team will send you a copy of that form. Oscar asks, what if the school is unable to provide a cost of attendance? This is for San Jose State University.
They should be able to do it. There's a specific form that we have you download and have the school complete to return to us. And public universities can tell you what the cost is. They can complete the form.
Okay, so there is a qualification on this. This was the response from the school. Unfortunately, we do not have any specific form for your request. However, we would be able to complete an official form from the institution that is requesting your financial aid information, or we can also officially stamp a copy of your financial aid information.
Right, and so that's a perfect example of where you download our form, provide it to your educational institution for them to complete.
Okay, thank you, Ben. Claudia asks, when you say work for the state, can you specify? I'm a notary licensed by the state and work for the county behavioral health department. Is that a conflict of interest?
It is not.
All right. Do we have any clarification on the conflict of interest, since there seems to be a lot of questions revolving around that? What would constitute a conflict of interest?
I would defer to Christina.
I think I'm going to let Clinton correct me if I'm wrong, that you would have to either be working for HCI or have a family member that works for HCI specifically. That's what I think. Is that right, Clinton?
Kind of, but that's kind of the idea, though, is that if you have some kind of connection to the grant award process, or if you maybe work for the legislature or something like that,
Right.
Something to that effect, where that there's a clear pathway where you can, like you have the winning lottery numbers, and then you also are applying for the lottery ticket too, like that kind of deal. Just to simplify the explanation, okay?
Right.
If you have a specific circumstance where you need some help on or whatever, send us your question. We'll try to help you the best we can. But that's the idea, is that if you have if you know somebody, or if you have a pathway or connection to having access to this grant opportunity above someone else who's just a regular participant, then that would be a concern.
All right. Yeah, thank you. The next couple questions were on conflict of interest, so figure we would get that answer out there. Roger asks, can I include the cost of offsite housing in my cost of attendance?
Yes.
All right, next question is, I'm a Title IV-E student. Will I still qualify?
No, because you're being funded by the CalSWEC through another grant program, another state grant program.
Questions on the presentation. Will there be another one? I believe this is the only webinar we're planning on doing at this time, correct?
For this program, we do have a second webinar later today to describe our Golden State Social Opportunity Program, GSOP.
Is the person who is designated to sign for the forms allowed to sign electronically?
Christina?
Yes. Via like DocuSign, yeah. Or Adobe, yeah, we do accept digital.
All right, reading the next question. All right, regarding qualified positions, I noticed BSW. I'm a current BSW as of 2017, working in the field of mental health services. However, also working on my MSW for 2024, When my time start now while pursuing my education or after my MSW graduation, I also plan to continue work with the same agency through my LCSW license hours.
That's wonderful to hear. The clock would start after you graduate in terms of your service obligation time, the 1 year. So congratulations.
All right, Amber asks, can you explain a little more about the 32 hours after education? What does that imply?
That is the equivalent of full-time direct services in a community agency of some sort that serves underserved populations.
All right, Jem is asking, when is the grant awarded? Would it potentially cover the cost of fall classes?
Christina, I think it's September, but I don't recall.
The application closes is at the end of August, I believe.
August 15th.
Yeah, so we will be making awards. Yeah, we're not sure how many applications we're going to have and how long it's going to take us to do all the scoring and applications, but I would expect that the money would be going out probably in the fall or winter of this year, I would expect. So yeah, I mean, it's meant to pay for your education, so it is meant to cover the costs of. It would be meant to cover those costs for the fall semester.
At a minimum, this is Clinton again jumping in. At a minimum, it would be at least a month, but we don't know how many applications we're going to have to do, but it'll be on like the fastest we could do it would be a month, but it may be more likely 2 months because there's going to be a lot of applications that we'll have to sort through. So after application close August 15th, so a month at the maximum, like everything is going well and there's no problems, but it could be up to 2 months. We're working on the details to that.
All right, thank you, Christina and Clinton. Janine asks, will HCI issue any future RFP to assist nonprofits with the cost of supervising students?
We're considering doing that right now. So that effort is under discussion currently, but it is our hope to do so.
Thank you, Anne. Veronica asks, how many applicants will be received?
This is a brand new program. We have no experience, but just based on the interest in this webinar, we anticipate a large number.
I've got a clarifying question from Carolyn from an earlier question about signing. Carolyn directs their social work program. She will be the person verifying the forms per this meeting's instructions. So can I sign it electronically or do I need to print and sign? Also, you were saying the school will have to provide the cost of attendance. So I would be the person that will be signing to verify as well. Can I sign that electronically?
Christina?
That should be yeah, that should be fine. I don't see what yeah.
All right, Jessica asks, I will be starting my 3-year MSW program. I will be eligible to receive this. Will I be eligible to receive the scholarship? If so, does the scholarship get distributed once I graduate, or at what point would that happen?
The scholarship would be awarded in September of this year, is our goal. And it's a 1-year scholarship. So if we offer the program next year, you could be eligible to apply again, keeping in mind that each scholarship carries with it a 12-month service obligation.
Great, thank you. Stephanie, will I qualify if I'm currently receiving Chapter 35 dependent education benefits?
We have no connection to that program, so yes, you could qualify. Yes.
All right, Marcella is another mention of this 2020 program. I'm a candidate a 2020 candidate for the County of Riverside. That commitment shouldn't interfere, correct?
I think I remember now what you're talking about, which is a program funded under a different category through the county. So this is separate from that, so you could qualify.
Right. Sonia asks, will the forms that need to be uploaded to the application be available in the application, or do we need to find them on a website?
Christina?
I'm pretty confident the cost of attendance and scholarship program verification forms are in the application. Is that correct, Clinton?
As well as the education. I mean, training, one of my terms, employment.
Right. I think the conflict of interest letter is the only one that might be not in the application. So if you may need to email us for that.
Dipti asks, I'm in the very beginning stages of a psychiatric nurse degree. There are several stages to this training, RN, advanced NP. Would I need to be in the ANP portion to apply for this?
No, you could apply while you're in the RN program, as long as you're actively enrolled in the educational program. Especially if you're going, let me back up. This assumes you're pursuing a degree in psychiatric mental health nurse practitioner.
Right. Katie asks, if your internship is in BH reproductive health, but you're unsure if you'll be able to get a job in reproductive health, what happens if you mark that you're interested in pursuing reproductive health, but your job post-graduation is in behavioral health, but not in actual reproductive health?
Please email us with that question. We'll have to check with our staff who are handling the reproductive health component of this program.
All right, thank you, Katie. Go ahead and email us and we'll find the answer for that. I've just finished my bachelor's in psychology program. Is there any way I can use this program and how?
You would have to be actively enrolled in another program, educational program. We do not fund loan repayment from this program.
And similarly, I'm finishing up my MSW before September. Am I eligible?
No, you would not be.
I'm a clinical psychology PhD student and will be going to my internship residency starting in July of this year at Cleveland Clinic. Would I qualify for this program?
I'm sorry, say the beginning of that.
I am a clinical psychology PhD student and will be going to my internship residency starting in July.
Yes, as long as it's part of your educational training, yes.
Does the SPV form needs to be printed out and scanned, or could it be filled and signed electronically?
Christina?
Electronically is fine.
Okay. Are the awards awarded based on just the points?
That's yes.
If the scholarship does open next year, do you know what time of year the application will be open?
It's hard to, I don't want to speculate about next year, but probably about the same time, possibly earlier.
Okay. Lydia, looks like we have a question about the cost of attendance, again from San Jose State. The HCI form for the cost of attendance, is that linked in the application?
I see another question saying it's not in there, Christina.
Yeah, I just talked to Clinton. We're trying to figure out where that is. I thought it was in the application, but we're figuring it out.
So if you could email us with that question, and we'll address your email.
If I volunteered in medically underserved communities, but not in a mental health worker capacity, does that qualify for the volunteering portion of the scoring?
Yes.
I'm not familiar with the scholarship for disadvantaged students programs. Does this mean that you need to have received that scholarship, or simply that you self-identify as having a disadvantaged background based on environmental and or economic factors?
Kevin?
Hi, I would recommend checking eligibility as defined by the Scholarship for Disadvantaged Students program, or identified as having a disadvantaged background based on environmental or economic factors, or received a federal exception financial needs scholarship.
Which you could do on the web.
Maddie asks, what does the point system determine exactly?
It helps us to rank applications, to assess how many we can fund and at what level.
Thank you. Taylor asks, are first year MSW students eligible beginning September 2023, or is this program geared more for second year MSW students?
First year MSW students is fine. I would also encourage you to look at the Golden State Social Opportunity Program, which provides 2 years for MSW students pursuing a clinical career.
Tonya asks, do you have to work in behavioral health specifically or just underserved populations?
If you're speaking to your service obligation, it's underserved populations. We assume because you're pursuing a behavioral health related degree that you would be providing direct services of that nature. It doesn't have to be in a behavioral health setting per se. There are organizations like community clinics that have a broad array of services, including behavioral health, that would be appropriate.
All right, thank you. And one asks, how much would a penalty be if we do not meet the criteria employment after 6 months? Are there any extensions? I may be entering a joint program which may change my current eligibility status of a 2-year program.
Christina?
The penalty would be, we do, if you're not able to find employment within 6 months, we do try to might give you a little more time, but if you do not meet the service obligation, you would have to pay back the scholarship amount, as well as $1,500 for each month of service obligation that you didn't complete. If your program is changing and you're going to be in school longer, then that would change with the date that you would have to start your employment by. So that would extend that.
Thank you.
All right. Let's see. Answered several of these questions we've answered already. Can we apply this year and next for the grant next year if we receive it?
Yes, it's possible.
All right. Yvette is asking about the link to apply. We have the link posted in the chat, and you should be able to find that there. All right, I am a Title IV-E student, and after graduation, I'll be returning my time back to the county. Does this program qualify to put my time in? Because I'll be working with children in child welfare.
Yes, it could. As long as you're providing direct services to the client. Yes.
How many points do you need to receive? How many points do you need to receive the scholarship? More points equal more funding, question mark?
No, the points will be used to assess the number of applications we can award. approve. And we will then look at the question of full versus partial awards as we look at the total number of applications.
I currently work in an FQHC. Would that qualify as working for a medically underserved area or population?
Yes.
Enrollment for MSW programs does not begin until this fall, so how will this impact my application?
You should have a letter of acceptance that you can, the form that we provide, you can send that to the school for verification of your pending enrollment.
Working for the county as a child welfare social worker, does that qualify me?
Yes.
Would working as an APS or IHSS social worker for the county count as qualified employment?
As long as you're providing direct services to the clients. And to clarify, in that environment, we're talking about employment for the service obligation 6 months after graduation.
Juan asks, would it be best to apply for the next cycle to receive more funding? I'm expected to graduate May 2025 and would have more points then, or can I apply this cycle and also the coming cycle if I would need more funding for educational expenses?
We can't tell you which program, which year you should apply. Historically, though, under our other scholarship programs, people have submitted applications each year that they were enrolled in their education.
Would a 501c3 nonprofit agency providing mental health services to children and youth and family qualify? Also, would a supervisor position qualify, or will all 32 hours, majority of your work, need to be in one-on-one clinical setting?
Supervising clinicians does count for your service toward your service obligation. That would the clock for which would start 6 months after graduation.
60 points on the scoring criteria be enough to qualify for funding?
We can't say. It depends on in total how many points all applications reflect in order to figure out threshold of minimum points for funding.
Stephanie asks, I'm not sure, but do I qualify if I'm a vet dependent spouse receiving education benefits?
That's a separate funding stream from the state, so you would qualify.
I believe my question was missed. In the grant guide addendum, it states that the applicants will receive 0 points if their graduation date is later than 12/31/24, but on slide 18, it says that the applicants will receive 10 points, which is correct.
Thanks for that. I did address that earlier, but I'm glad you caught that. That is correct in the grant guide and the addendum. We'll update the slides to reflect 0 points for graduation date later than December 31st, 2024 in the slide deck. Thanks.
I'm currently a graduate student at CSU Stanislaus and work for the state of California. Am I eligible?
As long as there's no conflict of interest, which if we would recommend you email us to get a copy of a sample letter to assess your eligibility.
All right, thank you. And lots of questions today. This is good. If you're working on our BASW and plan on getting MSW and then getting licensed, can our hours we work to get licensed count as our 32 hours a week 6 months after we graduate?
Not for this program. However, we would encourage you to look at the Golden State Social Opportunity Program, which we offer that possibility.
Thank you. Matt asks, which page of the website will this video be posted on? Matt, is going to be posted on the Behavioral Health Scholarship Program site. We will be sending that out to all of the registered attendants once it is posted. So you should see that in your email. Lisa asks, I go to CSUSB and the school has a generic cost for school breakdown that is downloadable. Is this what is needed?
Christina?
Yeah, I think that's actually what we want to use. Me and Clinton have been looking into this, and it looks like we, in the past, for cost of attendance, they can obtain that kind of information from their school, from the financial aid office, for a breakdown of attendance costs. That would be adequate for our application.
All right, thank you. Can you please clarify, is English a Medi-Cal threshold language? I'm finding conflicting information online.
It is not.
Does the lived experience need to be verified? How do untreated, undiagnosed cases count?
We have no way to verify your lived experience. It's you attest to whether or not you or a family or close person that you're providing caregiving for has a behavioral health condition.
Noya asks, what is the difference between this scholarship and the Golden State Social Opportunities Program?
The two primary differences is that the Golden State Social Opportunity Program is aimed at people pursuing a licensure as a clinician through the Board of Psychology or Board of Behavioral Sciences. And the service obligation is for 2 years, as well as the funding could be up to 2 years, same amount, $25,000 a year.
Thank you. And if we receive this grant, will we be limited or unable to apply for future state funding or possible loan forgiveness programs? In other words, is there a limit to receiving grants such as this?
I would defer to Christina and Clinton.
I think the only issue is if you're receiving awards concurrently, you need to basically complete one program before you start another program and complete it, including completing your service obligation.
Thank you.
Thank you, Christina. Tanya asks, if you speak the language enough to provide basic care but are not fluent, does that count for the scoring?
You would,
Yevon.
yeah, you would need to have fluency to provide direct care services to clients.
Maria asks, is the funding sent directly to the student or to the school via paper check or electronic?
Christina?
It's sent directly to the student and it's a paper check.
Thank you. Tonya asks, does the cost of attendance document we receive from the school need to be signed?
Christina?
I don't think so. Clinton?
To be honest, I don't know what the answer is.
I don't think so. I think it just needs to be from your school, clearly from your school, stating what the cost of the program is going to be.
Jonathan asks, are those currently receiving education funding from the Department of Rehabilitation eligible for this scholarship?
I believe they are, yes.
Claudia asks, will the award amount be based on the total cost of the program or for 1 year of the program? If the program is a 2-year program completion, can I apply 2 times for the same program, but for 2 different years?
You apply for 1 year at a time. If you're pursuing a clinical degree, I would encourage you to look at the Golden State Social Opportunity Program, which could fund 2 years.
Still have some questions regarding the availability of the cost of attendance form. Are we going to be upload?
Could I jump in here? I was
Yes.
offered a correction here. The cost of attendance form does not need to be signed. You get that for the school. It does not need to be signed. I apologize for getting this answer out so late here.
That's great. Thank
All
you.
right, thank you. And
So
the-
what was the question
Uh,
again?
people are having trouble finding our version of the form to submit to their school. There's multiple.
And what I heard Christina and Clinton say is that you request a form from your school with that information.
Okay.
Yeah, the cost of attendance form you got to get from the school directly, and it does not need to be signed.
Okay, so we don't have a form for that. That's why they're not finding it.
Correct.
No.
Is that correct? Okay. Apologize for the confusion
Chris?
on that. Yeah.
Chris, do you mind if I hop in for 1 second?
Go for it.
Just slight correction on a previous question about Medi-Cal threshold languages. You might see online English as listed, but it is not one of our listed questions for scoring. So our listed languages for scoring are Medi-Cal threshold languages other than English. Thanks.
Thank you for that clarification, Kevin. Can you please define behavioral health in a reproductive setting?
You could be a counselor in an abortion clinic, supporting clients before and after the procedure.
Right. And along with that, what if we're interested in either reproductive health or working with youth and mark yes now? Is that also going to be verified later? I'm just worried my interest could change once I get into the program and learn about opportunities.
So if you are seeking funds under the reproductive health eligibility, you would need to align your employment afterwards in a reproductive health related setting. Otherwise, I would recommend that you apply for the regular BHSP funding.
Olivia asks, are there any conflicts as the result of being a California student in an online program or belonging to a school with additional locations outside of California?
As long as you're a California resident, you would be eligible and you're enrolled, actively enrolled. Yes.
Okay. Dipti says that they're looking online and having a hard time finding the actual criteria for Scholarship for Disadvantaged Students program. Is there a link that can be posted for that?
Would you send us an email and we'll find the link? Or Kevin, do you want to?
Yes, please do send us an email. I can give you a little more information here on the webinar. From the tooltip that you'll see in the application, it says disadvantaged background as defined by the Scholarship for Disadvantaged Students program, Section 737 of the Public Health Services Act. This refers to individuals who have been identified by their schools as having come from a disadvantaged background based on environmental and/or economic factors. But yes, please do. You'll find up in the chat our email address for sending us the question for the link.
Kevin, can you post that information in the chat?
Yes.
Thank you.
All right, thank you, Kevin. Lynn asks, if an individual receives money through their employer who received BH Staff Incentive Program funding, can they also receive funding through this program?
Yes, they can.
Okay.
Well, let me back up. Want to be sure that you are not receiving funds under another HCI program. So you need to check with your employer as to the source of that funding. If it's not from HCI, under our community-based organization behavioral health workforce grant program, then you would be eligible for this program.
Right. Lisa asks, based off a previous question, can I extend my employment obligation if I join an MSW program after my BSW? I have not applied to the MSW program yet, and I am going into my senior year.
Yes, that you may.
Maddie, earlier question was, I'm currently in my bachelor program. So this is the follow-up question for this earlier question. I gotcha. The first question was, I'm currently in my bachelor's program for social work and anticipate going directly into my master's degree post-graduation. Will this pose an issue? The follow-up question is, applying for my MSW program will begin this fall, so I do not have any sort of paperwork to submit for that at this point in time. How will I go about proving that my graduation for my MSW will be a year following my BSW graduation next fall?
What matters is that you're enrolled in September, and so part of the education, I'll ask Christina to describe the program, I believe, or the form. I believe there's a form for verifying your enrollment in the program, Christina.
Yeah, I believe so. It sounds like you're enrolled in a program right now and you're going to graduate and then you're going to be enrolled in another program. So if you're enrolled right now, you should be able to apply for our scholarship. And then if you become enrolled in the next program, you would just send us that information. And then we could extend your grant agreement to ensure scholarship agreement so that you can wait until you're completed with your MSW before you would have to complete your service obligation. Is what I would expect.
Notice several comments still asking about the scholarship for disadvantaged students question. I think we're posting some information about that. If your question isn't answered, go ahead and email us and we will get you the information. Kayla asks, can we apply to both Golden State Opportunity and this scholarship since we aren't sure which one will be granted?
Yes, but you will only receive one.
Selva asks, would working as a social worker at an adult day health center qualify after graduation?
Yes.
Amber asks, will the 32-hour obligation be unpaid due to scholarship, and how do we enroll for the info session for the Golden State Opportunity?
To the first part of your question, that is work experience toward your service obligation 6 months after graduation. And the Golden State Social Opportunity Program webinar is this afternoon. If you go on the website, you will see that registration form. And if I could ask Alma or Muriel to post that in the website, in the chat.
We'll get the link to Golden State posted in the chat for you on that one. All right, let's see here. Answered those. I'm scheduled to graduate June 2024 with my BA in sociology and will be applying to grad school right after for an MSW. Does that qualify for the scholarship?
As long as you have proof that you'll be enrolled by September.
Can you work in a community setting that serves patients from different age groups, including 0 to 25, or does the service have to be only for 0 to 25?
We encourage you to serve this population, given that that's the funding source. But no, we're not limiting your service obligation to that population.
If a student moves to California for an internship placement, are they eligible?
I'm sorry, repeat the first part.
If a student moves to California for an internship placement, are they eligible?
They have to be a California resident when they apply.
So working in a labor and delivery unit in an underserved community as an RN would be considered for the reproductive health portion, even if it's not behavioral health?
Please email us with that question. We have to talk to our reproductive health team about that.
All right. Marissa, we have the email address posted in the chat several times, and we'll show it at the end of the presentation here in a minute. All right, the max award is $25K. Will the same amount of time, 12 months working in an underserved community, still apply if one received less funding? Will the required 12-month commitment be prorated, for lack of a better term?
No, it needs to be full-time.
Okay. Caleb posts a link and asks, is this the info we should be looking at to answer the question about disadvantaged students? Kevin, do you see that that comment there?
I do. For the link, I just ask you to please write to our email, and we will follow up about that.
Okay. All right, and the last question I have in the chat is, how often will this scholarship be offered? I think we answered that, but Ann, do you want to say it one more time?
We know we'll have it obviously this year, and depending on how much of the funding remains after funding this first cycle, we'll offer it next year.
All right. Let's see. And then, oh, one more. Would we need to be enrolled September this year or next year? It's this year.
Yes, this year.
Okay. Well, we are nearing the end of our time for this webinar, and that was a lot of questions. Thank you all for your participation in the Q&A session. And those were really great questions. As a reminder, we will post the recording of this webinar on our website in approximately 7 to 10 business days, and we will email you once that's done. And with that, I'm going to hand it back to Karen Rizel, Deputy Director with Health Workforce Development, for some closing remarks.
Thank you. And thank you so much for the interest in this program, for the questions that you asked. We are very excited to be offering this program, and we are excited that to see so much interest in this program. So we encourage you to go to our website and read the grant guide. We have an email address as well if you have any follow-on questions for us. We encourage you to sign up for our mailing list for ongoing updates about all of our programs, not only this one, but the other ones that we offer. I think if you look on the next slide, you will see, I think, some links to, here are some ways you can follow us when we advertise our programs. And then on the next slide is an opportunity for you to sign up for our regular update to learn about other programs that we're offering that could be of interest to you or those in your community. The email address is here as well for you to follow up with any other questions that you have. As was mentioned, we have another webinar this afternoon for our Golden State Social Opportunities Program that may be of interest to many of you also. So thank you again for the interest, for your desire to serve California, and we look forward to your application. Thank you. I will close the webinar. Thank you so much for attending.